The Criminalization of Homelessness and How We Fight Back is a three-part educational series that focuses on the Housing First model as a solution to homelessness and discusses the many threats that the model faces, including that of the Cicero Institute. This is session 3, Compelling Housing First Narratives. The full educational series can be viewed here. Session 1 was called Solving Homelessness with Housing First, and session 2 was called The Criminalization of Homelessness. We highly recommend viewing every learning session in the series for the most comprehensive understanding of the topics that we will be discussing. This learning session has 3 expert speakers who I will be briefly introducing. The first expert speaker in this learning session is Sean Leo. Sean is the Director of Communications in the Homeless Programs Office with the Veterans Health Administration of the U.S. Department of Veterans Affairs. The second expert in this learning session will be Dr. Grover Wayman Brown. Dr. Wayman Brown is the Narrative Specialist at Housing Narrative Lab. Our final expert speaker will be Andrew Bradley, Senior Director of Policy and Strategy at Prosperity Indiana. Sean will be kicking off today's session by talking about the VA's implementation of Housing First and how it's an important example that we should all be lifting up.
Great. Thank you so much, Hel. Hello, everybody. I figured it would be a good idea to kick off with the results and then talk about the implementation, largely because VA has been using Housing First since 2012 as our North Star in our work to reduce and ultimately end veteran homelessness. And from our take, the results of that, the proof of the pudding is right there. Since 2010 to 2023, we've seen an overall 52% reduction in veteran homelessness. This is both somewhat unprecedented in the history of our country, and we're seeing reductions when other subpopulations of people experiencing homelessness are either seeing their homelessness rates stagnate or in some instances increase as well. I do want to note here on the chart something that reaffirms our commitment to reducing and ending veteran homelessness. You see a little bit of an uptick from 2022 to 2023. This uptick represents a 7.4% increase in veteran homelessness. It's something that we're taking very, very seriously, and we'll continue to use Housing First to drive measurable reductions in veteran homelessness. We're hoping to reverse this course and do a lot of work in order to do that. Let's go on to the next slide, please. One of the other important things to note at VA is that similar to homeless continuum of care organizations and bodies that have many different programs and interventions to address a broad array of needs, housing instability, housing crises to homelessness needs that a person may have. At VA, we have those resources as well. We have the front doors for our programs and services in the form of outreach, engagement, assessment, and referral services. These range from actual clinical social workers that go out into the world to meet homeless veterans where they are, whether it be in encampments, under bridges, in tents, et cetera, or through our national call center for homeless veterans that is available 24 hours a day, 7 days a week for anybody who's experiencing housing instability, who may need to get connected to VA as well. We also have prevention resources, I should mention, that actually keep veterans in their homes and apartments right now. In the unfortunate event that veterans do find themselves homeless, we have residential services that provide them with temporary places to stay in the form of emergency shelter or transitional housing so that they can get out of the elements. And of course, all of this is driving towards permanent housing resources, ultimately with oftentimes with subsidies that make rent affordable for them, and short or long-term case management to provide them all of the wraparound support services, whether it be just pure case management or mental health treatment, substance treatment, primary care, specialties care, employment, all to make sure that when the veteran gets housed, they stay housed. I should also mention, because history of incarceration is one of the most powerful drivers, powerful risk factors for homelessness, especially among male veterans, we even have outreach that goes into jails and prisons so that as veterans exit those criminal legal institutional settings, we're able to get them connected to all of these resources. Let's go on to the next slide, please. This is what I call the alphabet soup slide. It has all of the names of our programs and services. You're going to get a copy of this. You can click on the link, would go to the website to learn more about the specific interventions, but it's essentially crosswalked to that map that we just saw. Let's go to the next slide, please. So with that in mind, talking about the outcomes of what happens when VA has adopted housing first as an approach, among all of the different programs and services, I want to take a little bit of time now to level set. What do we mean when we say housing first? So I'm going to commit a little bit of a training faux pas. I'm going to read a little bit from the slides, but you'll see why in a little bit. First, defining housing first. Housing first is an approach to ending veteran homelessness that providing permanent housing to people experiencing homelessness without preconditions as quickly as possible. It also connects them to voluntary services to give them the support that is necessary to sustain their housing. Core to housing first is a philosophy that essentially housing is a fundamental human right. At VA, we don't treat housing as a reward for treatment compliance. We treat it as a necessary clinical intervention and a human right that all veterans need and deserve. And we ultimately see that veterans are able to access the robust array of services, clinical services, and other benefits that VA has to offer if they have a safe and stable place with which to do so. The goal of Housing First then is to get veterans swiftly and connected into permanent housing and give them all of the supportive services they can without the historical barriers to that housing, such as sobriety requirements or other treatment requirements or other program participation requirements. Let's go on to the next slide, please. Now, I am an insufferable pedant in my day-to-day. It drives my family members crazy because I'm always being very particular with my words. Now, in terms of when I talk about housing first, I do find it critical, absolutely critical. And we've actually done this a little bit on the training so far, making a distinction between housing first as a model and housing first as an approach. And what I bet, if you find a lot of disagreement about housing first, oftentimes part of that disagreement is a little bit of a conflation between looking at housing first as a model versus housing first as an approach. When we talk about housing first as a model, we are going back to the evidence. We're going back to the way in which you actually structure permanent supportive housing programs in terms of staffing, in terms of how those staff engage with clients, how many clients you have on your caseload, how you structure all of that. There's whole different ways in which you actually build out a permanent supported housing program that is true to the model. And when we talk about housing first works as a model, we're largely talking about that evidence-based structure. But this is a little bit different from how VA has also expanded, and many others have expanded the concept of housing first into a broader approach. We could argue that this approach, although not evidence-based, is evidence-informed. It takes core principles from the actual evidence-based model and broadens it into other areas where it's really, really important to continue with the values and principles. As such, housing first approaches are often more focused on those values, principles, philosophies, dispositions as the guiding way to provide services. And this is especially important, I'm going to talk about this momentarily, in programs and services that are not permanent supportive housing. Interventions like rapid rehousing, even interventions like transitional housing and emergency shelter can all work from a housing first approach as well. And all of this really helps system-wide orientations towards housing first. So that I want to acknowledge is a way in which we can kind of resolve the tension between housing first as a model, which is largely limited to permanent supportive housing programs, to housing first as an approach, which can be implemented in a variety of different interventions and as your whole entire community or system-wide orientation. Let's go to the next slide, please. So a little bit of a history lesson in VA. When we think about housing first in VA, we largely think of it first as the model, right? And again, model approach. The model was first adopted by VA way back in 2012, way in the before times, right? And this was most closely associated with our Housing and Urban Development VA Supportive Housing or HUD-VASH program, which by and large is a permanent supportive housing intervention. It is probably one of the largest single permanent supportive housing programs in the country. And this is where we actually implemented it. During 2012, we actually looked at fidelity scales, fidelity models, started building out better our clinical teams and structuring the way that we delivered patient care to get closer and closer to the evidence-based model. But as we get into 2013, 2014, 2015, and start really expanding other interventions like rapid rehousing, figuring out how to transform our existing transitional housing resources to be more responsive to our veterans, we start seeing VA adopt housing first more as an approach, taking the core principles, not necessarily the structure or the staffing plan or the caseload sizes, but the key principles behind housing first, and then applying them to those different interventions. And we actually saw a lot of really important successes. For interventions like rapid rehousing, what a housing first approach led to was our providers essentially working with veterans who may not have had an income, may be struggling with minor substance use or minor mental health disorders, but who may not have actually given a chance because even if it's minor substance abuse, it was still substance abuse. Adopting a housing first approach gave access to those particular veterans. For even transitional housing programs, which if you hear in the news or hear people talk about, you would swear that transitional housing was anti-housing first. But in VA, we actually adopted housing first approaches in transitional housing programs too. And what that led is not only, again, lowering the barriers to access for those veterans who might be struggling with just some minor mental health or substance addictions, but also if veterans actually relapsed during their stay in a transitional housing program, it encouraged those providers to actually keep working with the veterans. They may place them in a relapse track or a recovery track outside of the core programming, but most importantly, still engaged in the care. And again, as I mentioned before, the results speak for themselves. Both adopting housing first as a model and as an approach in VA, we believe that it has led to the 52% reduction in veteran homelessness from 2010 to 2023. Let's go on to the next slide, please. Before I let you all go, I'm going to do a couple other bits about how we think about housing first going forward from 2023 on into the future. And there are 9 key principles that we are focusing on at VA that will continue to guide us as we implement housing first, either as a model or as an approach in VA. Number 1 is keeping veteran dignity and choices at the forefront. When you think about all of the different details, whether it's housing first as a model with the specific implementations or as a philosophy, what we believe is core to all of that is respecting veterans' choice and dignity. So long as they have a choice in what their care is, that we are not projecting our desires onto them, but we are responsive to what they're telling us that our needs are, we're on the right track. Continuing to prioritize the most vulnerable veterans. Lowering the barriers to entry or providing minimal or no programmatic prerequisites to accessing programs and services. Low barrier and immediate access, streamlined and rapid access to housing, staying relentless and offering supportive services. The veterans can tell us no, but we have an obligation to keep coming back and offering again and again and again. When veterans get into housing, really, really work with all of our other partners to prevent lease violations and reduce evictions. Increase the prevalence of recovery-oriented philosophies, working with veterans through their addiction and their mental health concerns as they access those treatment services. And then lastly, keeping the availability and access to sufficient supportive services available, both outpatient, but importantly in that community context, so veterans can stay in their homes whenever possible. Let's go on to the next slide, please. If you want to follow up more about how we've been implementing housing first, we encourage you to check out our podcast, Ending Veteran Homelessness. The January 2024 episode is titled, What's the Big Deal About Housing First? I sit down with 2 really, really important subject matter experts to not only talk about VA's history of housing first, we talk about why housing first has been controversial in the sphere, and then what we at VA are doing about it. We also dive in a little bit of the data, talking about how housing first has been effective in programs like HUD-VASH. We encourage you to check it out, Apple Podcasts, Spotify, or your podcatcher of choice.
Thank you, Sean. Now, Grover will discuss what messaging for compassionate solutions to homelessness looks like.
So, my name is Grover, and I'm part of a team of communications and policy change experts at Housing Narrative Lab. My colleagues are named to the left of the slide here, and at the lab, we work together towards our mission to build broad public support for solutions to housing insecurity and homelessness. Now, in April of 2024, we partnered with the National Homelessness Law Center and Lake Research Partners to understand people's opinions about homelessness and what they think about attempts to ticket, fine, and arrest people who are experiencing unsheltered homelessness. We also tested to identify which messages we might provide that could bring people more along with us in support of effective and compassionate solutions to homelessness, like Housing First. We polled more than 1,000 adults in every region of the United States, and my presentation today gives a top-level overview of what we learned from this polling and how to apply it in your public messaging to build support for Housing First solutions. Now, the driving overarching narrative is everyone needs a safe place to sleep. Next slide, please. Now, to start out, you might be wondering, what do I mean by narrative, and why is it important to the wide range of activities that we might do as part of our work together to solve homelessness? Narrative is a collection of stories, ideas, and meaning making that shapes how people understand an issue and available solutions to it. When we're making plans and policy to ensure that everyone has a safe place to live, we need to not only write great policies, hire great team members, and create safe and affordable homes. In order for us to win any of those changes and have housing for every person be a durable part of our society, we have to build broad narrative support for it. 3 reasons why narrative is important in our work to solve homelessness that we need to think about as we're creating messaging and interactions is 1, people act based on their beliefs and their feelings, not just their minds, not numbers. They support solutions based on what they believe is the problem. So, if they understand that homelessness is caused because people are pushed out of their homes from economic factors like the high cost of housing, or because of violence or a natural disaster, they're more likely to support solutions that emphasize housing first. We need to connect solutions that we name to real documented causes in order to combat the broad and harmful narratives that already exist in our society, such as that homelessness is inevitable, which it's not, or that homelessness is a choice. And finally, when our ideas are widespread and common, more people will join in action or get out of our way to make positive change. Next slide. Key findings from our national narrative research are that 1, an astounding number of people have personal experience with housing instability and homelessness. 2/3 of survey respondents have a personal connection to housing instability, and 3 out of 5 people have a personal connection to homelessness. More people understand the systematic causes of housing insecurity and homelessness, such as lack of access to housing that people can afford, than 3 years ago when we did this research. Today, 3 out of 5 people believe homelessness is caused by economic factors. People respond more positively to messages that include a specific call to action and clear solutions, making it important to name the housing and support services that we are advocating for. Homelessness and unstable housing are issues that people care about, and that we found that they're more likely to vote for elected officials who oppose plans to ticket, arrest, and fine people for living on the street. A significant number of people rejected plans to jail, ticket, and fine people for sleeping outside if there's no other shelter available. 72% of adults nationwide rejected ticketing, jailing, or fining people for sleeping outside if there's no shelter available, including 65% of Republicans, 67% of independents, and 80% of people who lean Democratic. A majority believe that ticketing, fining, and jailing people makes homelessness worse. And finally, our messages need to reach more people on a broad scale. We are seeing indications that some persuadables, which are people who can agree with what we're saying, but also might find merit in the opposition's arguments, right? People go back and forth one way or the other. That's an audience we call persuadables. And persuadables are up for joining our base and shifting towards support for our solutions, but they're also hearing a lot of messages from the opposition. And we need to broaden our sphere of influence and share our narratives more effectively and meet people where they're at. Next slide, please. So in our narrative research, in addition to asking participants to answer questions about their opinion, for example, we share recorded messages with participants and ask them to dial up or down based on their agreement or disagreement with what is being said. I don't have time in my presentation today to show you what that looks like, but I will share the top 2 tested messages. The first one is on the screen here. This message, "We all need a safe place to sleep," works well across audiences of people who are already like-minded with the perspective that everyone needs a safe place to sleep and we should provide housing and supportive services first. And it also worked well with people who are persuadable, who could agree with our views sometimes and sometimes with the opposition's view, and even has decent levels of support from people who generally are an oppositional audience and tend to believe that most of the time government just needs to get out of the way. This message, "We all need a safe place to sleep," starts out with a race explicit and inclusive statement that was also our top tested value statement. No matter our race, gender, or income, we all want to get and keep a roof over our heads. You'll notice that this message connects economic factors and homelessness and gives clear but not wonky solutions that people can understand, providing access to housing people can afford and support services they need to become stable. Next slide. The second most supported message across demographics was sharing a personal story of how someone came to experience homelessness and how they received help to become stably housed. Many times, a personal story like this is an effective way to carry the core messages that activate empathy, curiosity with people, and show effective solutions in action, not just in theory. So you'll see here that the central sentence in this message is, "Thankfully, I wasn't fined or thrown in jail for trying to survive." And then they go on to share what did work to help get them the housing and support they needed. With a sentence like that, we can address the problem and help people understand the decisions that we are needing to make as a community about solutions to homelessness and illustrate for them the success of receiving help to secure a stable home and job, and imagine how much worse their story and in general homelessness might be if we chose the other path. Next slide. While we tested the messages that came out on top, we encourage every person who's creating messages, who's talking to elected officials, to use the base messages, concepts, and ideas from our research to carry forward, but also to make them your own. So here we have a guide for crafting a strong message based on this narrative research and our broad research and work in general. So when we are crafting a strong message, first, we encourage you to establish an inclusive shared value. This example uses the top tested statement, but shared values are often rooted in a simple and broad idea like community or the basic need to have a home no matter who we are or where we're from. Then a strong message will name the problem because people know there's a problem. When we don't name the problems, they don't believe us or take us seriously that we're actually know what's going on and have a plan to address it. And then when we connect clear causes of the problem to the next section, the solution, we have a circle of a strong message. It helps build support for proven solutions and help people know that you know what's wrong and you have a plan to fix it that they can be a part of supporting. Next slide. Here's an example of a shared value statement in action. This is a social media post with a core message: everybody needs a safe, affordable place to live. In the longer text, like a caption, we might name really specific solutions people could get involved in, like supporting tenant protection or emergency rental assistance. But the image and the main message conveys the base values that everyone needs a place to live and that community has a role to play in supporting each other. Next slide. Here's an example of implementing connecting housing and homelessness to the cost of housing in the economy. It also uses a shared value of strength in order to do it. Strong communities have housing that everyone can afford. Next slide. Here's an example of leaning into specific solutions while sharing a personal story that people can resonate with. In this case, it's a social media image sharing the story of a vet who now works delivering packages and lives in his car. It names that housing and support services are needed for him to have his own apartment to return to each night. The image of the person who is standing strong, who is fully in their presence, looking into the camera, who has a role in our society. He has a job in this case, but there's other ways in which people have roles as part of our community, is an example of how to use images also to put forward narratives, not just words. Next slide. While we often think of communications work as happening through social media, and here are some examples of how that might look, there are so many different ways to apply these core principles online and in our one-on-one conversations with everyone, from our neighbors to elected officials. In the next slide, I will provide information on how to access our resources, on how to apply the findings from this research that we conducted in 2024, and also how to put our broad recommendations on shaping solutions to housing insecurity and homelessness so that we can all make narrative change a part of our work going forward. You can view the executive summary of our research on our website, housingnarrativlab.org, under resources, or by scanning this QR code. Please do connect with us on LinkedIn and Instagram, and visit us at housingnarrativlab.org to receive emails and see our most recent resources.
Thank you, Grover. Andrew will now share the call to action for this learning series. Before that, though, I would like to first issue a disclaimer that the previous speakers in this learning session are not necessarily affiliated with this call to action, given its policy and advocacy nature. Thank you.
Thanks so much, Hale. And before I start, I want to thank our speakers, both Sean and Grover. Excellent resources and examples of compelling narratives. And so what I want to share is a call to action. Because as Grover mentioned, compelling narratives are more effective with a specific call to action. We want to make sure to equip you with some tools that you can use to help build the case for housing first in your communities. So we're going to talk about ways to educate your legislators, build relationships that last and grow, and to stay connected in the fight. And first of all, we want to talk about educating your legislators. We want to make sure that they have some of the same information and stories that we have shared with you throughout this series. And first of all, what you want to do is to make sure to find who your elected officials are. Through the link that's on this page, you'll be able to find out who represents you at the federal, state, and local levels. And that's important. And if you're an individual, you want to know who represents you in office. If you are a community service provider, you also want to think about who represents your entire service coverage area. So I always share that advice to make sure that you input different addresses that cover your entire area. You want to know who are those legislators and elected officials. And an easy thing to do is to invite those elected officials to coffee in a kind of a low stakes way for them to get to know you and your work and why these issues are important to you. So whether you're an individual who sees the importance of housing first, if you're a community-based organization and service provider who works directly or indirectly with people affected by housing instability, that's your chance for you to get to know them. Introduce yourself, explain that interest and why that compelled you to invite them to a discussion. Then you also want to make sure to ask them about themselves and get to know their priorities. You might be surprised that they already have some connection. As Grover mentioned, a majority of people have some sort of connection to housing instability and homelessness. You might be surprised to discover that they have that connection in their personal or professional lives that you can then build on as you're building that relationship. And then finally, on this page, let them know how important the Housing First model is to you and that community. We've provided through this series some warnings about efforts to further burden the homelessness or the homeless with fines, fees, and arrests simply for being outside. Use that opportunity to warn them away and ask them to steer clear from expensive government camps and to instead listen to the experts on homelessness. So that is one of the easiest things that you can do is get to know your legislators and elected officials and share this information. We also want to make sure that you're building on those relationships. So on the next slide, there are ways that we provide for you to be able to increase your advocacy capacity. Every year, Prosperity Indiana puts on an Advocacy 101 series that is aimed at increasing your advocacy capacity. So again, if you're an individual or if you're with a nonprofit organization, we're going to tell you what the rules are, what it means to educate versus lobby, and where those lines lie. We're going to give you some examples from experts in the field, from people who have done this work for many years. And we're actually going to give you some practical exercises to show you what it's like to reach out to your legislators. The image that you see here is from a previous Advocacy 101, where we actually simulated what it's like to call a legislator's office and to convey a message and ask for a meeting. And so by doing that, we want to give you the confidence and the ability and the encouragement to be able to make those connections and to build relationships. And then finally, we also want to make sure that you stay in touch with the experts and with the people who are most connected to this effort. And one that I want to do to encourage you is to follow and join the Hoosier Housing Needs Coalition. This is a coalition of over 2,000 organizations and individuals statewide who are invested in increasing the supply of safe, affordable, and stable housing, including issues of homelessness and homelessness services. You can see here on the left, those are the organizations that make up the steering committee of the Hoosier Housing Needs Coalition. These are people who are involved in housing issues day in and day out. But we also have thousands of others that tune in to webinars, who join our advocacy efforts, who follow policy priorities, and who join in on action alerts. And by following the link that you see on the screen there, that is the best way, if you're in Indiana, to stay abreast of attacks on Housing First and to take proactive steps to increase that supply of housing throughout the state. I also want to encourage you to follow some national partners who are involved in the fight to protect and preserve Housing First. One is the National Alliance to End Homelessness. You can see their information here. They're some of the leading experts on efforts to defend against attacks on Housing First. So just by linking yourselves in, getting on the mailing list, seeing the events, keeping up with action alerts, that is probably the best next step for people watching this webinar, to be able to stay informed and to use that information to build the relationships that we just talked about.
Thank you, Andrew. With that, it is now time to conclude the final learning session in this series, The Criminalization of Homelessness and How We Fight Back. Be sure to check out the other 2 sessions in this series if you have not already viewed those.